Hello, greetings from Malla Reddy Narayana group of hospitals. I am Dr. Pranathi Reddy, gynecologist and infertility specialist. Around 15% of the world population couples are being affected by these infertility issues nowadays, and more so ever in the developing countries like our country, India. And according to the WHO, every fourth couple is not able to bear the child in their reproductive age group. This leads to emotional and the social stigma, where the couple are reluctant to open up and talk regarding their fertility issues, which not only hampers the early diagnosis but also the treatment at the right time. The biggest breakthrough in the treatment of this infertility was the birth of Louise Brown on 25th of this July in 1978 in England. This was the first female child to be born by the successful IVF conception by the tireless work which have been done by the Robert Edwards and his team. In this long journey of 42 years from 1978, so many newer inventions in the artificial reproductive techniques have taken place, and till date around 8 million children have been born through all these techniques. To mark this greatest innovation in the treatment of infertility, we celebrate this 25th July as the World Infertility Day every year. In our clinical practice, we see many of the patients and couples to coming to us with the common infertility problems like bilateral fallopian tube blockage, endometriosis and ovarian dysfunction in the females, and poor quality and quantity of the sperms in the males. Of course, lifestyle factors also plays a role in this, like increasing the age of marriage and postponing the childbearing age, and dietary habits like bad dietary habits, and along with that, of course, stress, anxiety, depression, they play a role. Alcohol consumption, tobacco use also plays a role in this. And next is like the artificial reproductive techniques, all the techniques which we use nowadays. In general, we stimulate the ovaries over here with some of the drugs to get more number, to retrieve more number of the eggs. So these eggs are being harvested or being retrieved through a minor surgical procedures and being combined with the husband's sperm externally in the laboratory, and they are being again inserted inside the woman's womb. At a woman's womb, that is the good embryos have been implanted inside the woman's womb over a specific period of time. The common procedures which we do in artificial reproductive techniques are the in vitro fertilization, and the next is the intracytoplasmic sperm injection or this ICSI, and cryopreservation of the eggs, sperms and the embryos, and pre-implantation genetic diagnosis. As we know, this subject is being rapidly evolving nowadays, with more of the scientific inventions coming day by day which are adding to these things. We are able to go in deeper insight into the subject, find out the causes and treat those causes with more increasing successful rates. Here in Malla Reddy Narayana group of institutions, we have all these IVF facilities over here. People coming far from all the different villages nearby, from Sangareddy or Medak and inner villages also, they are getting benefited over here at the lower cost of the treatment, and we have the high success rates. Thank you.